Hello everyone, I'm your host Brigitte Maassen. Now that Thanksgiving is over, you are finally free from all your responsibilities of taking care of your family. But Christmas is coming soon and New Year's Day won't be too far. Busy days will be around your house again. But don't work too hard, take a break once in a while and watch Senior Moments. Senior Moments covers events and activities at senior centers in the Ann Arbor Ypsilanti area, such as Ann Arbor Senior Center, Turner Senior Research Center, the Pittsfield Senior Center, and the Ann Arbor Community Center. Also, the show provides valuable information for senior citizens on such issues as health, wealth, finance, and entertainment. Senior Moments is a monthly show. It premieres on the last Sunday of the month at 5 p.m. and it reruns 10 times a week on CTN Channel 16. Also, you can watch the show on YouTube. Please log on to youtube.com/CTNArbor to view current and archived shows. You may not do winter sports anymore, but you can find so many things to do inside your house, like playing some instruments. I hope the Senior Moment Show will provide you with some useful tips for enjoying yourself at your house.
Hi, I'm Mitch with CTN. Did you know CTN is available on both Android and iOS platforms for free?
That's right, you can find us on the Cablecast app. Just look up CTN and all your favorite local programs are right at your fingertips. But that's not all. CTN is also on Roku, Apple TV, and Amazon Fire TV. If this is for you, visit a2gov.org/CTN. Then navigate to the About tab for instructions on how to set it up on your device. And subscribe to our YouTube channel, where you can watch our live meetings and all of our CTN-produced programs at youtube.com/CTN Ann Arbor. So come watch CTN, where we aim to connect, create, and communicate.
Hello, welcome to Senior Moments. I'm your host, Brigitte Maassen. You might think you're still too young to live in a nursing home, but the reality is that we are all getting older day by day, and the risk of falling, as well as declines in vision, hearing, and memory can begin to affect your daily life. Of course, you still want to stay in your home, surrounded by the pleasant memories of your family for as long as possible. So have you considered getting help from experts to support you in maintaining your independence? Today we have Lindsay Mann-Shanahan of Huron Valley PACE. She's going to talk about the organization and its services. And thank you for coming.
Thank you for having me.
And Lindsay, what we always do as our guest, they're interested about personally where were you born and and how you ended up working for PACE.
Okay, so I was born in Michigan. Went to Eastern Michigan and got my bachelor's in health administration. I did an internship at Fox Run in Novi, which is a continuum of care community. And during that internship, I rotated all throughout the nursing home, and there I found my love for seniors, especially those with dementia. So that's how my senior living career began. And then I worked in activities in a memory care.
Yeah.
I went into sales and marketing. I worked for home care and hospice. I worked for a nursing home, assisted living and memory care. And then the past 6 years, I've been with Huron Valley PACE. So kind of the full spectrum of the continuum of care in the senior living community.
So what is PACE?
PACE, it stands for Program of All-Inclusive Care for the Elderly, and our mission is to keep seniors, and by seniors we mean 55 and older, safe at home with our services and out of nursing homes.
What particular help do you give to seniors?
So basically the full gamut of care. PACE is our seniors' insurance, and we're the provider, so we do both. So you get your primary care, a nurse, a social worker, therapy, whether it's physical, occupational, speech, home care services, your medications, behavioral health, recreational therapy, meals, any medical equipment, so wheelchairs, ramps, scooters, and then we pay for all your hospitalizations. So basically all the care you could receive in a nursing home, but in the comfort of your own home.
I see.
And we also provide transportation to all of those medical appointments.
Okay. Who is eligible for?
So there is an eligibility criteria, and it's set by the state of Michigan. So we don't have control over the criteria. So you have to be 55 years of age. There's no waiver on that. You have to live in our service area, which is Washtenaw County, Monroe County, parts of Livingston, Oakland, and Wayne.
Oh, a large.
Yes.
Yeah.
The furthest north is Howell, and the furthest south is to the Ohio border in Temperance. And each PACE, there's about, I want to say 14 or 15 in Michigan, has different service areas and zip codes that they service. So none of us compete with each other. The next criteria is you have to be able to meet what's called Michigan Nursing Home Level of Care. And it's set, the criteria is set by the state of Michigan, and you need to need some sort of help in your home. Whether it's cognitive, whether it's physical, whether you have wounds, need dialysis, need oxygen, frequent falls, memory problems. Those are all different ways to qualify. And the last criteria is you have to be able to live safely, and I say that safely, in your home. Because what might be safe to me and what may be safe to someone else are different. So we look at that gray area.
Oh, I see. So you need to have some type of disability then?
Yes.
In order?
You need to have some type of medical condition that is continuous.
Yeah. And your organization, is this like a nonprofit or?
Yes. So we are owned and operated by Brio Living Services. They operate 5 PACEs throughout the state of Michigan, and they are a nonprofit senior living organization that has independent living, nursing homes, assisted living, memory care, affordable housing from coast to coast.
So is it like 24/7?
PACE, yes. So we have clinicians on call 24/7. Now our day center that's located in Ypsilanti is open from 8 to 4:30, Monday through Friday, and that's where we call them participants come, and they can receive meals, they can receive socialization, therapy. We have a clinic attached, so they're medical appointments. Now you don't have to come to our day center, but it's highly encouraged because everything is right there. We also provide, let's say you're in a wheelchair and you need help getting ready in the morning. We can provide a home care aide to come help get you ready so you can get on the bus and come into PACE. And maybe you need help when you get home. They can help get you ready for dinner, maybe you need a shower, and then starts all over the next day.
Also, you provide the transportation and everything to it, yeah.
Our transportation is through Huron Valley Ambulance, which is through Emergent Health, and they do all of our transportation. And
Yeah.
they also do our on-call services. So if one of our participants calls 911, we know it's one of our participants. And our
see.
goal is to try to triage that and say, is it a true emergency? Can we keep this person out of the hospital?
Okay.
Of course, if they want to go, we have to let them go. But our goal
Okay.
is, and as you age, you'll realize in a hospital setting, they're going to run a full gamut of tests that maybe you don't need. Maybe
right.
you already know you have these issues.
Yeah.
But, you know, when you call 911 and you go to the emergency room, that can happen.
Right.
So if that does happen, we try to get them out as soon as possible and return them to home.
Yeah, you better, you're safer at home.
Yep,
than being,
we advocate for them
yes,
too.
I definitely, because from my own experience.
Yeah.
You want to be home,
Everybody wants,
definitely,
and you
because,
heal better at your
because
home.
you get no rest
Nope.
in a hospital. And plus you can pick up, a lot of things.
Exactly.
Because, that can happen very easily. So who pays for those services?
So that's a good question.
Because
and
it seems unbelievable.
too good to be true, right?
Yes.
And that's one of the things we always
Must
say.
be so costly.
Well, if you qualify for both Medicare, which you qualify for age for Medicare or disability, and Medicaid, all PACE services are free. So out of the 300 participants we have, almost all of them, there's only a few, pay privately for our services. Our Medicaid criteria is different than in the community. There's an income limit. So for those who qualify, your gross monthly income cannot exceed $2,901. That's set by the state of Michigan, and then you can have a small amount of assets, a home and a car. If you're married, it's more complicated, so we'll just stick with the single person for this show. But yes, and so Medicaid, so the state and federal government give us money every month for each participant, and we have to use that for all of those services.
Oh, because I was, I have some notes, and I thought, so I don't forget to ask anything.
Yes.
And I said, when I hear, what you all provide, I felt like, this is incredible.
It is. It's really wonderful. Does it work for everyone? No. But getting the word out to help more people is my job. But again, we're a nonprofit. We don't have a ton of marketing dollars.
Right.
So, grassroots marketing, word of mouth is the best way for us.
So I hope, our program today will be, because I had never heard of it.
Oh, well, yes, if we can educate one person, that's great.
Yeah, I will definitely, I have a lot of friends, my age, so maybe they're not aware of it,
Absolutely.
So I just, and you already told all the, what you have also educational programs.
So in our day center, our recreational therapists bring in all sorts of different programs. And it all depends on, we call our patients participants, what their needs are. Do they want to learn art? Do they want to learn how to use their cell phone? Whatever it may be. We have people 55, and I think our oldest participant is 102, 103.
Oh my goodness.
So that's a wide range of different likes, dislikes, and abilities.
Oh, I can't, because I know, because you provide, literally everything.
We do. Everything a nursing home provides, we provide. So if I were to give you like a short commercial, I would say we're a nursing home without walls.
Okay. Basically would be living at home and having all your help. You stay at home and you don't have to go into a facility.
Correct.
And maybe some people like it, but I think most people like to be at home.
That is, I feel that's the goal of most of us. That's my goal.
Yeah, my goal too.
Yeah.
If I can,
Correct.
do this. Because as soon as I heard about this program, I felt like I need to find out about it, because I'm thinking ahead, because you don't want to wait till all of a sudden you stand there and you say, what are you going to do? So do you have to kind of maybe, I know in nursing homes or residences, you have to, there's a waiting list?
There's no waiting list, but with PACE, you can only enroll at the first of every month. So if you were to contact us today and all went well, we met you, we do your assessments, you already have Medicaid, then we could enroll you December 1st. The biggest hang-up is if you don't have Medicaid, it's applying for it. So we help the person apply, and we have our own worker with MDHHS that just manages our caseload.
Okay, so because I always confuse it, Medicaid and Medicare. Care,
I always think of CAID as aid, so you need assistance.
Oh.
Medicare is age-related.
Yeah, Okay, I see. Okay. And then how does PACE compare to other organizations, who do similar things?
So AgeWays, which was Area Agency on Aging prior, they have a similar service, but it's not as inclusive, where you can pick different vendors to provide your home care or your therapy services, where we use everything and we are responsible. AgeWays is different in the fact that you can pick your own and they don't have as much responsibility over you as PACE.
Okay, so you're better off with PACE, actually.
I think so, but there's something for everyone. And
No, because, this is really very, interesting for me and educational for me. And because I had a neighbor and she had like 24 hours, somebody come to her house. So she had like 8-hour shifts and so on, So, but I think it must have been a private organization or something. So that's
my guess would be yes.
Yes.
And we do home care and we do quite a bit. We don't do 24 hours at someone's house. Usually if they need someone there 24 hours and it's a long term, we look into maybe placing them in a group home or assisted living. It just depends on the situation.
So you find the right
fit for them.
Fit. That's great.
The least institutional.
Yeah, okay, because, that's what I was really curious about. And then because it seems like, because you see everywhere when you look around, all those nursing homes are happening. When I moved there was only one 46 years ago, and all of a sudden, but I think people are getting older, and I think you need those facilities. And I think another thing what I like about you, because you have also, you can go for programs during the day, because socialization is so important for older people.
It's so important.
Yeah.
And a lot of the facilities that are popping up are the more for-profit assisted livings that are expensive, and not everyone can afford them, and not everyone wants them. So it really just depends on your needs and your wants. I think, the day center provides that socialization piece along with the medical piece all in one.
Right, yeah. So let's say you don't qualify for Medicaid, then how do you, is there a certain set of fee, or how does it?
So there is a fee. You would pay the Medicaid rate, so it depends on the county you live in, but it ranges from $4,000 to $5,000 a month. It's a lot more than most people can afford.
Exactly, yeah.
But it's cheaper than assisted living. So we don't have many people, like I said, just a small amount. The problem is those people get left out. One day our goal is to have a sliding scale, maybe a fee scale. States like California, they have something like that. And that's where PACE started. So they have the most PACE programs in California, second most in New York, and third highest in Michigan. So
Michigan.
In Michigan. And the newest PACE is opening in Alpena.
Oh, up north.
And that's the most rural PACE in the U.S.
Wow.
Yep.
That's amazing.
Isn't that amazing?
Yes.
And there's such a need.
And when did your organization start here in Michigan?
Huron Valley PACE has been here for 11 years, and I believe the first PACE in Michigan was in the Southfield, Southeast Michigan, and they started in the 1990s, and it's called PACE of Southeast Michigan, and they're the mothership PACE, we call them.
And where are you located here
we're in Ypsilanti, off of Ellsworth Road.
Okay.
Ellsworth and Gulfside.
Oh yeah, okay. Now I know. Okay, because I'm definitely going to come and check it out. And
you have to.
No, because I would like to see this.
Bring friends.
Yeah.
You'd love it.
Yeah, that's what I was thinking. I have a couple of friends who are my age, and even older, and to see that is, where is a possibility, they could and then stay in their home.
Absolutely.
That's the main thing.
Another thing, we're always looking for volunteers.
Oh yeah, that's what I was wanting to know. Oh, great.
Yeah, so if you'd like to volunteer, your friends would. When I give you a tour, I can introduce you to our volunteer coordinator. We do get a lot of donations from food gatherers, so they help. A lot of our volunteers help our participants shop for fresh produce. As you know, food insecurities, that's never going away. So even though we provide food, we have partners that also help us out. And then we rely on volunteers as well.
Oh, that is fantastic.
Yeah.
And then you get an idea what it's like,
Absolutely.
And you don't, I think it's one thing is you get a little bit frightened when you get older and think, oh, okay, what's going to happen to me, And I mean, as long as your mobility and you're very independent, it's fine. But as soon as you're not, then
It's scary.
It is scary. So your organization seems to me like fantastic.
I think so.
And I can see. And so, what else do you think you would like to mention? Maybe we didn't cover.
I'd like to mention, if anyone is interested in learning more about PACE, scheduling a tour, they can call myself or they can call our enrollment department. We have just a general number. It's 734-572-5777. And you can say, I want a tour, I want to learn more about PACE, or go to our website. You can submit an inquiry form and we can reach out to you that way. I always tell people when they tour or visit, they may say, I don't need PACE. I'm like, but what if you have a neighbor? What if you have a friend?
But you can tell somebody,
yes.
yes.
That's what I want. Help me spread the word.
Yeah, I think that's very important. So, so how many participants do you have right now?
I believe we have 298. And we can service up to 360 in Ypsilanti. And we have a new day center that's opening in Monroe in June, which can service 150 additional participants.
Okay, so you have a limit.
We have a limit. We have not exceeded it, and if we need to increase the limit, we apply through the state of Michigan.
Well, I think probably, but also because you have a limit, you can really do very personalized service too.
Yep.
So otherwise you would be overwhelmed.
And we have certain benchmarks that we set for growth. So when we grow to a certain number, we know we might need to hire another physical therapist, another social worker, another nurse practitioner. So they have panels of participants, so you get to know your medical team very intimately.
Is it easy to find people to work, or have, the expertise?
It is and it isn't. I mean, we're in Washtenaw County, we're very blessed, right? And it's such a unique model that you have to think everyone we help could be living in a nursing home. But we're stuck with the task of figuring out how do we keep them safe at home. So throughout our different specialists, they meet every day, they discuss different issues, and they triage ideas. So what can we do for this person? What are their needs, or what is his needs? And we make it work. We have guidelines. We're funded by Medicare, Medicaid, so by the state and federal government. But our mission is, how do we keep this person safe at home? Maybe it's just a wheelchair ramp. Maybe it's an electric scooter. Maybe it's grab bars. Or maybe it's more complicated. Maybe we need to change their schedule or their medications. Maybe they need increased therapy services. It really it's different for every person.
It's very personalized.
Very personalized.
And probably you would also come to the home to find out, what is safe in the home and what, if there should be some changes with bars or, and so on.
And we use a lot of grant funding. If there's when I worked on the enrollment team, I helped get a man running water. So he had the home, but his pipes burst when he was in a nursing home, and he came home and didn't have running water. So I found a local plumber to donate services. I found a nonprofit to donate parts, and he had running water. Even though he considered it safe without running water, if you're sending someone medical in, they got to be able to wash their hands.
Right,
So,
right,
you know,
yes.
it took a little bit longer to get him enrolled, but he was enrolled and able to stay at home.
So basically, you take care of all the needs. A person.
We do the best we can.
Yeah, I mean, it just seems too good to be true.
It does.
I'm just thinking about it. I already felt a lot easier just knowing which is all available.
There's such a thing out there, yeah.
Yeah, and I know I have several friends and people I know who are in facilities, and the cost is horrendous. I mean, it's just, I mean, this, is more affordable too.
Absolutely.
That's very important.
Very.
And because you get frightened, it's like, what's going to help? Do I, kind of ruin my children? That they have to take care of me, or at least support me financially and so on.
And we always want to support the caregivers too. A lot of our social work team reaches out to their caregivers and says, how can we support you? What can we do to make your life easier? Like laundry services, that can be a huge burden for someone. Well, we can do your laundry. We can help with showers. We can help with light housekeeping. And those are just some of the little things.
Okay, because I have a friend, and I mean, she's lucky she has a husband still, but he is not in the best, condition too, in the long run. And I just wonder if they know about you. I think that's the first thing I'm going to do today, check with them and tell them
Absolutely.
about your organization. Well, is there anything else we think we should include in our presentation here?
I think we covered most of it.
Yeah, I mean, you're fantastic in just telling all this. And
thank you.
I'm just, I'm just taking all this in.
When you're passionate about it, it's easy to speak
Yes, I totally understand. No, thank you so much, and then also I know there will be the information on screen, the phone numbers, the addresses and everything, how your name, how they can get in contact with you, so which would be fantastic,
I would love that.
Yeah, thank you so much for
You're welcome.
taking your time and giving us all this information and making people aware, so I'm kind of checking around and seeing with people I know, do you know this? Do you know about this? Because I learned this all today. Actually, I learned it before when I got the information. I'm thinking like, what is this PACE,
Now that you're more aware, you'll see our buses around.
Well, now exactly, it's true, because when you were mentioning you pick people up, and I felt like, I know I have seen, but I wasn't aware
What we do, yep.
Exactly, because I think a lot of the nursing homes or assisted living, or I don't know what all the organizations, the only one I have been to years ago was University Living. I think because the friend I'm talking about, her mother-in-law was there. But in the meantime, there's so many, every time I drive, I'm saying, oh my God, there's another one,
You're right.
So there must be the greatest business not coming up, in here.
There's something for everyone out there.
Yeah, it's great. Well, again, Lindsay, thank you so much for taking the time and informing us and
You're very
giving us
welcome.
all this information. Thank you again.
You're welcome.
It was a pleasure meeting you as well. And I probably will see you at your
Yes.
facility as well.
Sounds great.
Yes. Thank you for joining us on Senior Moments. I hope you enjoyed the show. I'm Brigitte Maaßen. I wish you happy holidays.